Mr. Mackey. My name is Ms. Shalay. I'm a student nurse. I'll be performing a physical assessment on you today. Is that okay with you?
Yes.
Alright, so it'll take me about 25 minutes to perform this assessment. Let's see. I'm going to check your pupils. Pupils are equal, round, and reactive to light. Patient is awake, oriented. Let's see. To the situation, time, and place. Let's see. I'm going to do an assessment on your skin right now. So you mind lifting up your shirt for me just to see. Alright. Patient has tattoo on the upper right arm. And a tattoo on the upper left arm. Skin on the arms are evenly distributed, and there is pink and warm. Shake on both sides, equally bilaterally. I'm going to check your capillary refill. Capillary refill is less than 3 seconds. Alright, so now I'm going to, and the nail bed is colorless, and the skin around it is brown. I'm going to check your hair. So the scalp is oily, hair is evenly distributed, the skull is normocephalic, round, and symmetrical. The scalp is lighter than this other skin, the patient's complexion. There are no scars. Do you feel any pain? Okay, and no pain. There are no presence of any nits or lice. No presence of alopecia. The hair isn't brittle. So the skin on the face, it is evenly distributed. There is a scar on the upper right of the face. The eyes are leveled at the upper third of the face. The lips are at the bottom third of the face, and the nose is symmetrical. So he does have presence of facial hair. The neck, no trachea deviation. Neck is midline the body. Okay. Let's see. Next, I'm going to look inside of your mouth if that's okay. Use my little light. Say ah for me. Alright, so there is present, let's see, all teeth are present. Let's see. Okay, so there is saliva present as well. At this point, I'm going to first palpate your carotid arteries, one at a time. Okay, now I'm going to listen to them, and I'm just listening to see if there's any narrowing. Okay, carotid pulses are strong and equally bilateral. Alright, and it has a regular rhythm with no groups. At this point, I'm going to check your ears for symmetry. Okay, ears are symmetrical. So ears are symmetrical. I'm going to touch them now. Alright. And they have immediate recoil. Let's see. Did you feel any tenderness or anything? So no tenderness over the auricle on either side. Or the tragus. Let me know if you feel any tenderness. No tenderness over the mastoid process either. Alright, so let's look at your... The outer canal is absent or free of any foreign objects. If I were to use an otoscope, I'd be looking at the tympanic membrane to make sure that it is a pearly gray and shiny. So we already said on each side and just sniffing. All right, do this other side. Okay. So the nose veneers are painted. Let's see. It's not light. All right. So the frontal and maxillary sinuses are without tenderness as well. Now I'm going to go ahead and check the other sinuses. You mind leaning your head this way? This is going to be your, the other way. Thank you. This is going to be your posterior auricle. Alright. And below it, up front, is going to be your tonsillar. Okay. Now I'm going to touch your occipital. It's going to be towards the back. Alright. And your superficial cervical. Alright, now I'm going to touch your submental and your deep cervical chain. It's going to be in 3 areas. Okay, so your posterior cervical, okay, and your supraclavicle. Alright, so there was no tenderness present there. And next, we can go ahead and move to the lips. The lips are moist, pink. There's no presence of cracking. I'm going to look at his buccal mucosa with my pen light again. And as I said before, all teeth were present. But let's see about your hard palate. Or if you have a hard or soft one. Okay, palate is hard. And let's see, say ah for me so you got your tongue. Okay, so the tonsils are present. They're pink, no evidence of swelling. And let's see your dorsal surface. Okay, so it is pink with white coating. The tongue is moist, as I said before, with saliva present. Let's see, now let's do the thorax. You mind sitting up for me? I'm just gonna check your spine. Just leaning over a little bit. Okay. So the spine is midline. There are no lumps. I'm gonna palpate. Let me know if you feel any pain. You feel any pain? Okay, no pain present. Next, I'm going to percuss the lungs. So thank you. All right, so resonance and sound on percussion. There was no tenderness present. All right, so now if you will take a deep breath from me, I'm going to listen to you. And this is just listening to your lung sounds. And next, I'm going to listen to you up front, your anterior side. Okay. All right, and so let's see. The vesicular sounds were, of course, present in the anterior. There were no adventitious sounds present. Next, I'm going to listen to your cardiovascular system. Now look first, see if I see any pulsations. I don't see any pulsations. Let's see, next I'm going to palpate your aortic, which is going to be on the right intercostal space. Next, I'm going to palpate the Erb's point. It's going to be on the second intercostal space on the left sternal border. Okay. Now I'm going to palpate the tricuspid. That's going to be on the left sternal border. And the mitral, fifth intercostal space. Now I'm going to listen to them all. regular in rhythm. No additional sounds or murmurs present. The S1 was more prominent in the tricuspid and mitral. S2 more prominent in aortic and pulmonic valves. And next I'm going to inspect your skin on your abdomen. Do you mind lifting your shirt for me? And I'm just going to check and see if you have any tattoos, hair, scars. So hair is present. There is a tattoo on the upper left chest. All right. And no scars are present. So no striae present. Let's see. I'm going to, let me look at your umbilicus. All right, umbilicus midline, and it is inverted. So now I'll palpate. I'm just gonna touch you lightly first. Do you feel any pain when I'm touching you? All right. So no pain is present. I don't feel any masses. So in your right upper quadrant, that's going to be your liver, your left upper quadrant, spleen. All right. In the right lower quadrant is where the appendix is. In the left lower quadrant is the descending colon. All right. So next, I'm going to go ahead and listen to you just for vowel sounds. Okay, so vowel sounds are present. They're hyperactive. There is no visible peristalsis. The abdomen is round. All right, so at this point, I'm going to look at your arms. And so he does have hair present on his arms. The hair is evenly distributed. Again, let's see, check the temperature. The temperature is warm. Okay. All right, and let's see. I'm gonna look at your, do you mind lifting your pants up for me? I'm gonna look at your legs. I'm gonna check both sides. So if you could face me this time, sorry. Okay. So hair is present on the legs, evenly distributed. Skin is warm bilaterally. Skin is intact. Let's see. And no viscosities. And let's check your posterior tibial. Okay, the rate is regular bilaterally, and the rhythm is regular at a 2+. Let's check your dorsalis pedis. All right. The rate is regular bilaterally, rhythm regular, and the amplitude is 2+. Now I'm going to check his capillary refill on his feet, on his toes. Okay, capillary refill less than 3 seconds. There is no edema present from the knee on down to the ankle. All right. Let's see. And I'm going to, at this point, we're done. Thank you. Oh, I didn't check your blood pressure. I apologize. Let me check your blood pressure. Then we're done. All right, lift your shirt up for me, please, sir. Thank you. So I have 130/72. All right, and I'm going to count your pulse rate. Okay, respirations are 16 and the heart rate is 80. Alrighty, so you're done. Thank you, Mr. Mackey.